Hello, my name is Dr. Peter Frederick, and I'm a GYN oncologist at the Roswell Park Cancer Institute in Buffalo, New York. And today I'm going to be talking about something that might be of interest to many women, and this is new guidelines for cervical cancer screening that have recently been released by several national organizations in the United States. Two separate organizations have released revised screening recommendations for cervical cancer. One is the U.S. Preventative Services Task Force, and the other was a multidisciplinary group consisting of the American Cancer Society, the American Society for Colposcopy and Cervical Pathology, and the American Society for Clinical Pathology. And both of these organizations have released very similar recommendations regarding when to start screening, how often screening should be, and when to stop screening. There are two main tests to screen for cervical cancer. The first we call cytology is traditionally called a pap smear or a pap test, and that is essentially taking some cells from the cervix and looking for abnormalities that can be pre-cancerous changes. The second test is to look for HPV, or human papillomavirus. We've come to understand that virtually all cervical cancers are caused by certain forms of HPV, and that women that test positive for this HPV are more likely to go on to develop cervical cancer over time. I guess what is new about these guidelines is the interval between pap tests has been increased from every 3 years to every 5 years in women that have both negative cytology and a negative HPV test. And that is because new studies have been published that have shown that women that test negative for both of these tests have a very low risk of going on to develop cervical cancer in that time. Essentially, just to summarize, these organizations both recommend that pap test screening should not be done in women younger than the age of 21 or in women older than the age of 65 that have had adequate screening. In women that are ages 21 to 29, pap test screening is now recommended every 3 years. And in women between the age of 30 and 65, either every 3 years with just the pap smear or every 5 years with a pap smear and the combination of HPV testing. In women that have had a hysterectomy that includes removal of the cervix and have no history of abnormal pap smears, continued pap tests are not recommended. We've known for a number of years that doing a pap test every year in a low-risk women runs the risk of over-testing. And that is because cervical cancer is typically very slow growing. It usually takes between 5 and 15 years to go from an HPV infection to actual cervical cancer. And we know that about 50% of women that are diagnosed with cervical cancer have never had a pap test, and another 10% of women haven't had a pap test in the last 5 years. So this is the patient population that we would like to target with our screening. These recommendations reflect a balance between benefits and harm. And many women that have an HPV infection that may be reflected with an abnormal pap test will clear that infection on their own in about 1 to 2 years. So if that infection is identified, it can lead to overtreatment. And so we don't want to treat aggressively these women that will get rid of the infection on their own. And I think it's important to emphasize that these screening recommendations are for low-risk women in the general population, women that are at higher risk for developing cervical cancer, such as women with a history of prior abnormal pap smears, women with a history of immunosuppression, HIV, organ transplant. These recommendations may not apply to them. So I think it's important to talk to your doctor individually to discuss these recommendations and what they may mean for you. So a common question that we get is, now that pap smears are no longer recommended annually, does that mean that a woman no longer needs to go for her annual visit? And the answer to that is no. The pap test is just a small part of providing health care to women, and the OBGYN or primary care doctor can provide many other services during the annual exam.